Can biomarkers detect Huntington's disease early? Imagine knowing years before symptoms appear if you are at risk for Huntington's disease. That possibility is becoming more real thanks to advances in biomarker research. Biomarkers are measurable indicators of disease processes. For Huntington's disease, scientists are exploring different types to catch the condition early. Imaging biomarkers are one of the most promising tools. Structural magnetic resonance imaging scans can spot shrinkage in the brain's striatum, a key area affected by Huntington's. These changes can show up many years before movement problems start. Diffusion magnetic resonance imaging is another technique that looks at tiny changes in white matter, the brain's communication pathways. It can detect alterations in the corpus callosum, a major white matter tract, years before symptoms appear. Magnetic resonance spectroscopy measures small molecules in the brain, like lactate and alanine, which change early in the disease process. These methods can reveal disease activity even when the brain looks normal on regular scans. Blood tests are also being developed to find early signs of Huntington's. Researchers have identified certain markers in blood plasma, such as mitochondrial DNA, which correlates with how severe the disease is. Elevated levels of mitochondrial DNA can be seen in people who carry the gene expansion but have not yet shown symptoms. Other blood markers include aggregates of mutant Huntington protein and protein modifications that increase as the disease progresses. These are easier to access and can be monitored over time. Urine tests are being studied as well. For example, 8-hydroxy-2-deoxyguanosine, a marker of oxidative stress, has shown potential for tracking disease progression. Skin and muscle biopsies can also reveal mutant Huntington protein deposits, reflecting what is happening in the brain. Timing is key when it comes to early detection. Imaging techniques can identify changes up to 25 years before clinical signs appear. In young adults with the gene expansion, signs of neurodegeneration have been seen nearly 23 years before motor symptoms are expected. For families considering genetic testing, these biomarkers add a new layer of information. They provide objective, measurable data about disease activity and progression. They can help track how well treatments are working and identify the earliest stages when intervention might be most helpful. However, standardizing these tests across different labs is still a work in progress. Some advanced imaging methods requiring specialized equipment and trained personnel, which might not be available everywhere. Despite these challenges, biomarker research offers hope for earlier diagnosis and better management of Huntington's disease. In the future, combining genetic testing with these biomarkers could give a clearer picture of individual risk and disease course. This approach might allow for earlier treatments that could slow or even prevent symptoms from developing.